Today, we will be performing a periodontitis treatment on a 50-year-old patient. We carried out 2 professional tooth cleaning procedures within the scope of pre-treatment. A bacterial test was carried out at the same time. Based on the test result, aggressive periodontitis was suspected. The patient had already expressed a wish for her own teeth to be preserved as long as possible. For this reason, we will be carrying out a closed periodontitis treatment aimed at a maximum reduction of bacteria. This treatment will be performed using perioscan. Here you can see the X-ray findings the patient brought with her when presenting in our practice the first time. Advanced bone decay of up to 9 mm can be recognized in the upper jaw and also in the lower jaw posterior tooth region. In the second quadrant, teeth 2-6 to 7 were extracted, as preservation was not possible. As part of endodontic pretreatment, the apically hardened teeth 3-4 and 4-5 were treated endodontically. At tooth 1-7 in the mesial region, you can clearly see concrement build up. Concrement is also clearly visible on the root surface of tooth 4-6 in the distal region. First, the treatment area is anesthetized. Probe depths between 3 and 9 mm were determined. The maximum degree of loosening was 3. Some of the posterior teeth have been lost to aggressive periodontitis. Before beginning treatment, we will now once again check the probe depths in order to get an overview of the current situation. Tooth 4-5 is being probed. The pocket depth here is just under 7 mm or 6 mm, for example. For the interiors, it is a little less. Here the pocket depth is 5 mm, 3 mm, 3 mm, 3 mm, 4 mm. You can very well recognize the resulting bleeding that is caused by the inflammation around the tooth. Probing is performed until perioscan indicates calculus. First go through the pocket horizontally and then again vertically, so that all areas are covered systematically. Then the unit is activated in order to remove the calculus. Afterwards, the surface is checked again to make sure that all calculus has been removed. The pocket is probed a second time to check the treatment results. Periosonic shows mainly green. However, individual areas must be treated again Now the root surface seems to be clean, and the treatment continues in the mesial region. You can see very clearly how the calculus is being removed. Here you can see the horizontal movement very well on the visible neck of the tooth. Now we check again, and the unit continuously shows green. We have completed treatment in the first and fourth quadrants with perioscan. The patient will return to our practice tomorrow in order to complete treatment in the second and third quadrants. Today's treatment was very satisfactory. We were even able to access the difficult regions of the posterior teeth so that we can be certain that most of the concrements have been removed.